Welcome to VJOncology podcasts, where we deliver clinically relevant insights from the forefront of oncology research and practice. In today's episode, we focus on artificial intelligence and its applications across the cancer care continuum. From advanced screening algorithms and precision diagnostics to AI-assisted biomarker development and individualized treatment guidance, we'll explore how AI is transforming clinical decision-making. Leading experts will share real-world applications and emerging data across breast, sarcoma, kidney, gastric, and lung cancers, providing a high-level perspective on integrating AI into everyday oncology practice. Our first segment addresses AI in breast cancer screening and risk stratification. Christina Lang from Lund University discusses advanced algorithms that enhance detection sensitivity and specificity while providing individualized patient risk assessments. Let's hear her insights.
So in my talk, I will present the potential of using digital tools that can change screening. And the most obvious tool today is the use of artificial intelligence. It's such a big and prolific field. There's such an intense research going on, trying to solve many problems that we have in screening today. And one of the problems is that we want to detect more relevant cancers early. And that can be a challenge with the current methods that we use. And we can then use AI to predict the risk of cancer, but also to use it as detection support. So these two applications, determining the risk and the use of AI as detection support, there are several very interesting studies going on and also being published. When it comes to risk prediction, we have seen that when you add imaging-based parameters, you can improve the traditional risk models that you have, and that can then be used to adapt your screening program as a risk-based screening approach. And so far, there's been one randomized controlled trial where they used an AI-derived risk prediction model to identify women that can then undergo supplemental MRI imaging. And that was a Swedish study, the Screen Trust MRI study. And what they found is that after a negative screening mammogram, when you add MRI, you could detect more cancers. So that's a very interesting development. But there are still some questions that need to be addressed because not all women want to undergo MRI. And it's also the question of the cost of using MRI in the screening program. But then we have mammography screening, which is a widely acceptable screening method that's recommended in our European screening guidelines. And it's a very good method, but it can be better. And there's been a lot of studies that have shown the potential of AI analyzing mammograms. And during the last couple of years, I've conducted a randomized controlled trial called the MASSAI trial, mammography screening with artificial intelligence, where we wanted to see if we can apply AI to improve the efficacy of the screening program, but also to reduce the workload for radiologists. And this study was conducted in Sweden with 106,000 women. And so far, we have published 2 results from this study. And we can see that it's safe to screen with the AI in mammography screening. So even if we reduce the workload for radiologists, we do not detect fewer cancers. And in a recent publication in Lancet Digital Health, we can see that when we add AI, we can actually improve the cancer detection rate quite dramatically. So we detect 29% more cancers without increasing false positives, which is a really important issue because we need to have a good balance between sensitivity and specificity in screening. And then it was also the question, do we detect the relevant cancers? And what we could see in our study was that the majority of the extra cancers that we detected using AI, they were mostly invasive cancers. They were small and they were lymph node negative. And also when we check the subtype of cancer, we can see that we not only detect more luminal A cancers, we also detect more HER2 positive luminal B and triple negative breast cancer. So these results are very strong. And also at the same time, we can reduce the workload. And since breast radiologists, it's a its workforce shortage in this discipline. This is something that is welcomed by the discipline. So we can already now see that AI is being implemented in many screening programs, especially in the Nordic countries, where it's starting to get implemented almost in the whole country.
Next up, Robin Jones from the Royal Marsden Hospital discusses how AI can refine sarcoma diagnosis and support therapeutic stratification. Accurate histopathological classification is critical for selecting optimal targeted therapies, and AI is increasingly informing these decisions in sarcoma.
So I think artificial intelligence, or AI, holds great promise in terms of potentially refining the diagnosis of sarcomas, and also in terms of developing precision therapeutics. Again, I'd say that this is still very much in the research arena. And firstly, for diagnosis, as you've already mentioned, these tumors are incredibly heterogeneous, and I think it will take many years before artificial intelligence is routinely used to make the diagnosis of a particular sarcoma subtype. But we definitely need continued research in this field, again, to refine and to develop the best tools for not only diagnosing these rare tumors, but also in terms of hopefully being able to better guide and select effective therapies.
Continuing on, Charles Parker from UCL discusses the development of digital pathology-based, multimodal, artificial intelligence-derived models for high-risk and localized metastatic prostate cancer.
The big problem we have in prostate cancer now is of one of our own making. There have been a huge increase in the number of treatment options for metastatic and non-metastatic hormone-sensitive prostate cancer. But now we have a problem of over-treating some patients and under-treating others. And it's difficult to know which patients are the ones who are going to benefit the most from additional treatment. So one way that we can look at this is trying to better understand patient prognosis, so how well the patient's going to do regardless of their treatment. And currently we use clinical variables to determine this, but they help up to a point, but they're not perfect. The same goes for my specialty, so pathology slides. We can gain some prognostic information from a histopathology slide, but it doesn't give us the whole story. So we know that there's other patterns that's going to be hidden within that tissue that can really help us understand tumor behavior and help us understand how well patients are going to do. So to that end, we partnered with Altera AI, who've developed this multimodal artificial intelligence model that can extract data from whole slide scanned images, combine it with clinical variables, and then have built that into a deep learning-based neural network, which can then produce a prognostic score trained against prostate cancer-specific mortality, which is one of the outcomes of our interest. So the background to this study was Altera have already developed this test in the localized disease setting, but the trial I'm associated with, Stampede, has patients of much higher clinical risk and who are in greater need of understanding how best to utilize the treatment options available to them. So what we wanted to see is whether this model could be applicable to our setting.
Moving on to gastric cancer, Hyung-Dong Kim from Asan Medical Center outlines an AI model developed to predict Claudin 18.2 expression in gastric cancer, an important development given the benefit of zolbetuximab in Claudin 18.2 positive tumors.
This study actually aimed to develop an AI-based model to predict Claudin 18.2 expression in gastric cancer. So with the introduction of various potent first-line regimens like ICI plus chemotherapy, recently 2 phase 3 trials have demonstrated a survival benefit of addition of zolbetuximab to chemotherapy in Claudin 18.2 positive tumors. So the treatment landscapes have become increasingly complex. So in this regard, there needs to be some guidance as to which regimen to go. So this AI-based approach employed 2 AI models. The first one is to develop an AI model to predict Claudin expression so that the patient could screen for the zolbetuximab-based chemotherapy. And the second model, which was presented in part in ESMO last year, this AI model predicts immune phenotype. So inflamed immune phenotype is associated with the benefit of adding ICI to chemotherapy in the first-line setting. So in this study, we developed a model which showed a quite promising predictive value in terms of predicting actual claudin expression. So the AURC was around 0.8, which is quite acceptable, and sensitivity for detecting claudin 18.2 expression was above 80%. So, and combining these two AI models, we were able to find a subgroup of patients who had non-inflamed phenotype and who were predicted to be positive for claudin 18.2 expression. So in the validation of the clinical outcomes, we found that for these patients, ICI plus chemotherapy was not effective for prolonging progression-free survival and overall survival. So meaning that these patients may not be candidate for ICI plus chemotherapy, requiring alternative treatment options like zolbetuximab plus chemotherapy. So that's the main message of this study. And regarding the accuracy of the biomarkers currently available ones, about 1/3 of patients who are classified to be immune non-inflamed and claudin 18.2 positive actually had high PD-L1 expressions, meaning that currently available biomarker, which hugely rely on PD-L1 expression, may not be accurate. So this study can provide some aspects to compensate the currently available biomarker. Yeah, so we need to validate whether this AI model could predict patients who are likely to have favorable outcomes with zolbetuximab plus chemotherapy. So after that validation, there could be more clear guidance on the deciding treatment regimens.
Finally, Ronan Joseph Kelly from Baylor University discusses how deep learning applied to imaging biomarkers can predict overall survival in patients with advanced non-small cell lung cancer. These prognostic insights have the potential to refine treatment strategies and clinical trial design.
Well, I'm very excited about this abstract. So this was run through our new institute in Texas called the Texas Cancer Interception Institute. At that institute, we're really looking at novel AI strategies to see how we can help improve the outcomes for patients with cancer, looking at digital pathology, looking at radiomics. We're looking at a whole host of assays to early detect patients and to predict risk of recurrence. This was a novel biomarker from a company called Onc.ai. The serial CT response score is a AI imaging biomarker, which is really looking to see if we can improve over RECIST, which is a standard radiological evaluation. That really just measures the tumor diameter and some of the volume of the disease. What this new biomarker, the serial CT response score, it takes it a step further in ways that the human eye can't read. The computers are able to read the tumor vasculature component as well as some body composition scores. So putting them all together, now you've got the traditional measurement of the tumor lesion, but now the body composition and some of the blood vessels that may or may not be entering the tumor. That's where I hope the future is with AI in terms of radiomics. And this was a study where we were able to show that we were able to outperform the traditional radiological evaluation. So very exciting. And a lot of companies, big pharma companies, are looking at this to be incorporated in some of their next generation trials. So very exciting study. We did this at Baylor Scott & White, throughout our health system, and very proud of the results.
Thank you for all of our experts for contributing. Across these segments, we've heard how AI is shaping early detection, diagnostic accuracy, biomarker development, treatment guidance, and outcome prediction. Thank you for joining us on this episode. For more information on the use of AI in oncology, visit VJOncology.com. And don't forget to subscribe to stay informed on the cutting-edge oncology innovations.